Hi everybody, this presentation is going to cover how to perform the weekly maintenance on the Cobas 600 chemistry analyzer that we have here in the Florida Hospital Waterman Laboratory. There are 3 objectives. So after completion of this training exercise, the laboratory technologist should be able to understand the importance of performing the weekly maintenance. They should be able to operate the computer software to program each step required to complete the weekly maintenance, and they should be able to perform all the required hands-on cleaning of the specific parts inside of the analyzer with minimal supervision. So first of all, why is it important? Why is it important that we do our weekly maintenance? We all do our daily maintenance every day, but why is it important to do our weekly maintenance? Our weekly maintenance is just as important as our daily because it helps to maximize our efficiency for our laboratory testing. It helps ensure that our instrument will continuously run and not break down. And I know when they break down, it causes a lot of stress and it causes us to get behind in our patient testing. And then it also helps reduce the risk of sample contamination because if we're doing our cleaning that's required of us, it's going to help cut down on that risk that samples could be contaminated. So in order to do the weekly maintenance, there are a couple things that you're going to need. And in our lab, we have this little cleaning kit here of everything that we need. And in that kit, it includes DI water, alcohol prep wipes, there are gauze pads, 2% Eco D solution, there are cotton tip applicators, Clean, and a little paintbrush that we use for dusting purposes. All right, so before we start talking about the weekly maintenance, these are the 2 home screens that we need to be familiar with because both of them will be able to take us to anything we need to do inside of the analyzer. The first screen here is our home screen that shows us our patients and our QC and calibrations that are running. And from that first screen, there are 5 little bars up at the top, and you're going to click on any one of them, and it'll bring you there to the second screen there. And that screen is a little bit more detailed, and that will I find that it's a little bit easier to maneuver once you're in that second screen because there are a lot more buttons and a lot more detail, and it can get you to things a little bit quicker. So the first thing we're going to do is make sure the analyzer is in the standby mode before we do any of the maintenance. Now, standby is something that we've all become really familiar with, especially if anything is wrong with it. You need to reset it or do anything with the instrument. The first thing we do is put it into standby. So when we're doing our maintenance, that is also the first thing that we're going to do. So how we do that is we press that big start button. You go ahead and press that, and it'll bring up the second picture there in the second screen, and it'll say rack reception mode, and it should be checked. But what we want to do is you want to uncheck it, and once you uncheck it, you're going to click OK. After you do that, the instrument will go into a post-operative mode, and that'll take a few minutes, so just be patient, and it'll start to shut down. And then up in the top left corner, it should change, and it'll say standby up at the top. While this is going on, you can go to that home screen again that we talked about previously and make sure preventative action is checked. And it's right up there in the top left corner, and just make sure that you select that. You want that selected when you're doing any of your maintenance. And then at the very end, when you're done running your calibrations and controls, you'll want to go back and uncheck it. It'll be the very last thing that we do. While the instrument is going into standby, you can actually check over your reagents, and it's very important to do this so we don't have to stop during the day. Just use your best judgment and picking which reagents we need to unload, which reagents we need to put on, because there are only a certain number of slots that the instrument will hold, so it can only hold so many. But a good clue for taking some off and replacing would be ones obviously that are expiring, that expired that day, with 1 day remaining before they expire. Save your coworker some time. If you see it, go ahead and take it off. Or any reagent that has less than 10 tests. Now, the less than 10 tests, kind of use your best judgment, as I said before. If it's a test that's in a BMP or a CMP, or it's a troponin, or a CKMB, something we're doing a lot of, make sure you go ahead and replace them, especially if they're a reagent that's on the 601 side, because you can only replace reagents on the 601 side if the instrument is in the standby mode. So be really, really careful about those. Also, the 601 reagents, make sure you check them now and go ahead and get them out, because they do take 45 minutes. They have to sit at 45 minutes at room temp before they can be put on. So how you can check your reagents is you can see in that first picture there, you'll be at your main home screen. You can go ahead and click on reagent and make sure that setting is selected, and it'll give you all your reagents that are on your the instrument, and it'll tell you how many tests are remaining, and it'll give you the expiration date and how many days are remaining. It's a really good page to just kind of check, throughout the day. Just keep an eye on it. It's just a good thing to know. So once you do that, you're going to go ahead and print your reagent load and unload list. This is a really good guideline once you check it over for yourself. Because again, you want to use your best judgment. Sometimes the analyzer will print out something that it's a test that we don't do a lot of, but it's telling you to replace it. So again, just use your best judgment. But we'll go to that first home screen there. You're going to select reagent preparing, and then that second screen is going to come up, and you're going to touch reagent load list, and you're going to select yes, and then it'll print you out a list and tell you what to take off and what to put on, and just kind of compare between what you had wrote down and what the computer had printed off for you. So while we're doing that, or after we're doing that, you're going to make sure you replace your NaO HD wash on the 501 side every single time the maintenance is done. So this is done for the daily and the weekly and the monthly. It's done every day, no matter what. So the first thing you're going to do is you're going to touch that reagent tab. Make sure status tab is selected, and select the appropriate detergent. And the appropriate detergent for the NaO HD is the very first one. And then at the bottom, you're going to touch reagent volume reset, and then OK. And I'll move on to the next slide so you can see what they look like. Make sure that you are not refilling that wash bottle, but you're replacing it with a new one. I know some people I've heard were getting a new bottle and pouring it into the old one, and that's not what we're supposed to be doing. We're supposed to be just getting a brand new bottle and replacing it and dumping the old one down the sink and flushing it with water. We don't want to start mixing wash solutions or reagents, and you don't want expiration dates to cross and things like that. That'll be where we start to have problems. So just make sure we get a new bottle and we start fresh every day. So by this time, your analyzer should be in the standby mode, and double check just to be sure before you go opening anything. Just make sure it's going to say standby mode up in the left-hand corner, and then you'll go ahead and open the top part, the top cover for your 501 side, and you're going to first clean your cell rinse nozzles with DI water. Just take a gauze pad and moisten it with DI water, and just gently run it across each of those nozzles, which are in that first picture there. And then the second thing you want to do is clean your cell covers, and the cell covers are in the second picture. And there are those two silver covers. I left one up and left one down just so you could see that there are two of them. And just take an alcohol pad and just wash the front and back. And then the next thing you want to do is remove and clean your IS bath with DI water, and then put it back. As you can see in the first picture, you can see my hand. There are two screws. You just unscrew them. It's not very hard to do. And then you just wiggle the bath out. And then the second picture there is my hand. I'm holding the bath in my hand. Just take a cotton tip applicator, moisten it with DI water, and just get inside of those creases and just clean it really well. And then put it back, and then screw the little caps back on. And you're done with that. And then the next thing you're going to do is clean your rinse stations. And each of those pictures, there are 3 rinse stations, and there are 3 pictures to show you where each of them are. And you're going to use your cotton tip applicator, and you're going to moisten it with your 2% Eco D solution, and go ahead and clean inside each of those. Once you go ahead and do that, you're going to fill the stations with the 2% Eco solution. And it says about 10 mLs, but it doesn't have to be exact. It's just kind of to give you a good idea. Once you do that, you're going to fill about 100 mLs of DI water. So again, it's just a general idea. You're just rinsing them out. Just make sure you can't see any more bubbles inside of them. And then we're done with that. The next thing is we're going to clean the sample probe and the shield pipe with an alcohol pad. And the sample probe, you can see in the first picture there, it's connected to the pink part that you see there, and it's a probe that drops down. and you're just going to swipe over that with an alcohol swab. And then the shield pipe, you can actually see it in both pictures, but a close-up picture is in the second one. And just clean inside of that with an alcohol pad, and just be very careful not to drop one down in there. That would not be good. And then again, you're going to clean the reagent probe, ISE probe, and ISE zipper nozzles, and they're all pictured there. And down at the bottom, you have your 2 reagent probes. Up at the top right, you have your ISE probe, and then down at the bottom is your zipper nozzles. All right, and then you are done with your the manual cleaning for the 501 side. So you're going to make sure you close that cover nice and tighten the lock. If it's not tightened good enough, the machine will throw a red flag and an alarm, so it just kind of puts in delay in what we're doing. So just make sure it's really nice and tight. Once that's done, you're going to take a cotton swab, moisten it with DI water, go ahead and walk all the way around to the back side of the 501, and there'll be a little drain port there as pictured in the second picture down there at the bottom. There's usually like a little drop of water that's attached to it, and you're just going to go over that with your cotton swab. And we do this just to make sure that dab of water doesn't crystallize, so we're just making sure we're cleaning it every day. If it crystallizes, that's not good. And then the next thing we're going to do is do our backup and sample data clear. So what we're going to do is you're going to touch your sample data clear tab at your main screen there, and you're going to select backup and clear, which is in your second picture. Click OK. Then you're going to make sure mass storage is selected, and then you're going to store it with the file name of month/day/year, and make sure binary is checked, and then touch OK, and then yes. And this is going to take just a few minutes for it to make sure everything's deleted and saved, and then it'll bring you back to your home screen, and then you're done with that part. Next, you're going to delete your print buffer, which will get rid of all of our patient information, your QC results, your calibration results, all of that will go away, and it'll just give us more storage on our computer for the next day. And so what we're going to do there is you're going to go to your print screen, you're going to touch View, touch Delete, and select OK. And just to double check that everything was deleted, you can go ahead and press that refresh button and make sure nothing is there anymore. And then we are done with that, and now we are ready to